Want the reward? Do the damn work. Challenge yourself. Inspire change. Choice, not luck. Good afternoon, everybody. Todd Crandall, the original sober triathlete, bringing you another awesome podcast. I have Dr. Melanie Worley on the show. Did I say your last name right?
You did, yeah.
Okay. Thanks for coming on today. It's nice to meet you.
Nice to meet you. Thanks for having me, Todd.
I just found out that you are a Sylvania Northview Wildcat.
Yes, yeah, I graduated in 2011, believe it or not. So it sounds like forever ago now.
Well, I graduated in 1985 from there, so that's forever ago. What a small world, really.
Yeah, I grew up in the Toledo area from third grade to high school, so I consider it my hometown.
Well, there's a lot that I want to talk to you about today. You are very impressive. Your resume is powerful. But let's talk about growing up in Toledo and Sylvania. And you obviously took one path, and I obviously took another path. Talk about growing up and why you chose the awesome path that you are on, and why did you avoid drugs in the first place?
All good questions. So we moved around a little bit before going to Toledo in the Carolinas and back in Ohio, lived in Cincinnati for a little bit, was born in Columbus, and then started third grade on in Toledo. And initially, we actually lived in the city in the Old West End, which people might be familiar with. So lived there from third to seventh grade. But I was playing for Pacesetter Soccer Club out in Sylvania and had a lot of friends out there. So we decided to make the move between seventh and eighth grade. So then I ended up going to McCord Junior High my eighth grade year, and then staying with the public school system and going to Northview after that. And yeah, I had a great time growing up in Sylvania. I loved all of my friends. I played soccer, basketball, lacrosse, and then ended up getting more into cross country running. And so switched from soccer to cross country. And can't say enough good things about my experience at Sylvania Northview. I felt like because I wasn't involved in a lot of activities, I think that made it easier to make friends. I was not only a jock, but also a band nerd, was also in band, so I had kind of friends in all areas. And yeah, I just thought it was a great experience and it set me up for success. Took a lot of AP and honors courses, graduated at the top 2% of my class. I think I was around like six out of however many. I think we might have had around 300 in our class or so. It was around 1,200 total for the four classes of Northview. So I was ambitious, trying to get all A's type of student at the time. I had floated around the idea of medicine in high school just because it made sense in terms of me enjoying interacting with people, helping people, liking volunteering, and then being good at the sciences. So I think that all my teachers at Northview were great and encouraging and helped kind of get that background at a young age that I could be confident wanting to go into that when I began my undergraduate career. So then I went to Wake Forest after that. And you mentioned kind of the other part in terms of being sober. And I can relate in terms of some of this because I do have an immediate family member with an addiction. And so I've seen how that can affect family dynamics and my grandparents and my dad. And so I think also just kind of being raised with parents who were attentive, encouraging, supportive, helped me kind of stay clear of that path. And then just channeling my energy into the sports and friendships that I developed rather than focusing it on those areas instead.
Well, to me, it makes perfect sense why you ended up the way you did. And like I said, I took a different path. I don't want to get into my own stuff today that's already documented. But here's the question I have for you.
Mhm.
It appears from you rattling off your experience as a young kid, you liked who you were and valued who you were as a person, correct?
Yeah, I think that's a good way to put it.
Yeah, yeah, and that's the antithesis of what I know I felt about myself and everybody that I've encountered
Mhm.
who are unfortunately choosing drugs and alcohol, they just don't find any self-worth. And talking to you right off the bat, you can see why people take those paths. So enough
Mhm.
of that stuff. Talk to me about let's start with the running, because again, I didn't know that you ran the Racing for Recovery 10K or 5K all those years ago. Talk about running and why you liked it so much.
Yeah, running was a great stress reliever and just an outlet. In high school, I played soccer my freshman year, and then I ran track and kind of got convinced by the cross country or distance coach to come over to the dark side of running. And so I did that from sophomore to senior year at Northview. And, my sophomore year, I ran in the state championships and was quite good. And then kind of had some injuries that I was battling my junior year. And then my senior year, I sort of just had fun with it and was focused on getting into a good college, so I didn't take it quite so seriously. And then looking back, I actually probably could have ran like Division 1 cross country, because what happened was is I started channeling my running a little bit more as I got into college, and I really grew and I really got faster on my own. And so that was sort of interesting. And then I ran for Wake Forest Club cross country team, and we did some really fun meets. We even went to the national meet. There was one in, I think it was at Penn State area in Hershey that we traveled all the way to, as well as the one in Charlotte, North Carolina area. So I competed in both of those. Even tried to see if I could walk on to the team my junior year at Wake Forest, but didn't end up panning out and just kind of kept having fun with it. So, and then as I got better, my senior year, I decided to run a marathon with a friend in college while we were in North Carolina. And I happened to qualify for my first Boston Marathon off of my first marathon ever. So I was like, wow, maybe I could be pretty good at this distance running thing. And so that just sort of spiraled into me training more and more. And then so my first and second year of medical school were in Athens, Ohio, at Ohio University. And I would actually train with the cross country team there because I had a friend on it from high school. So I would run with the girls essentially and, kind of keep up with the team, even though I wasn't running for them competitively. And then I moved to Toledo my third and fourth year of medical school to do my clinical rotations at Mercy St. Vincent Hospital, which you're probably familiar with,
Yeah,
um,
yeah.
downtown. So I chose that on purpose because I wanted to be back in the area. And then I started racing for Dave's Running, which a lot of people listening in the Toledo area would also know about. And so that's when I started really realizing how fast I could be, running a 38-minute 10K. Ended up getting like around a 18:29 5K, which for me, I'm more of a distance like marathoner or half marathon. So that was a fast 5K time for me. And, in high school, just to reference, I was only in the low 20s. So that kind of improvement was pretty cool to see. And just kind of, if you put your mind to something, what you can be capable of and really focus. And then another thing we will probably touch base on as well with that is that I started to become plant based, and I noticed an improvement in my running through that as well. And so I kept with it.
Oh, we're going to have a good conversation today. This is awesome. To say that you're an overachiever is a slight understatement. You had mentioned the cross country training as a kid. Looking back, do you guys think do you overtrain in high school cross country training? Do you think?
I don't think so,
Okay.
actually, for high school. Yeah, I think that our coaches, or the ones that I had, at least at the time, did a good job balancing that. I've noticed more in the endurance world now, and you can probably relate to this doing more Ironman, which I switched to in the last few years. That I think, and especially being in Boulder, Colorado, the mecca of endurance athletes, I think there's a lot more overtraining that happens when people are getting into that realm of the endurance world sports. Mhm.
So you were talking about having some injuries, I think, in high school. Is that what started leading you to pursue more of your medical degree? Was, hey, I'm getting these injuries. Yeah, go ahead. That's interesting.
It definitely is one reason, or one of the reasons I chose sports medicine and orthopedics for sure. In terms of medicine in general, I think that was more of just me. realizing that I loved helping people, and then the combination of the math and science felt like a good fit for me. And I didn't have any doctors in my family, and so it just seemed like a neat field to kind of go into. And then, yeah, so what happened was after I ran that first marathon in my first year of medical school, I ended up getting a surgery, a knee scope for plica removal, because I had tried like many, many months of therapy and was still kind of getting this uncomfortable clicking in my knee. So they ended up going in and removing that. And no, it's funny because knowing what I know now, I probably would have tried to avoid surgery and gone more of the PRP orthobiologic route. And so that's what started my interest. And then that's also why I ended up choosing the non surgical sports route where we help
Yeah.
people avoid surgery because I had surgery, kind of saw that side of things and was like, well, if there's a better alternative, with less downtime, less harm, less risk for developing arthritis later in life, I think that would be a really cool path to take and help people with. And then I can also relate as a patient and an athlete, both, which I think really helps with my patient care too.
Wow, I'm fascinated with talking to you today. Let's do the plant-based thing first.
Mhm.
Why plant-based personally and in your professional medical
Mhm.
expertise, which I love saying, why do you endorse that plant-based nutritional aspect?
Yes, good question. So I initially got into it kind of around my senior year of college, just looking at some of the data, knowing that I had gotten into medical school at the time, watched some of those famous documentaries on Netflix that also opened my eyes to some things. And then I dove down into the literature a little bit more. And it's first for health reasons, of course. So, what really intrigued me was Dr. Esselson's studies at the time showing reversal of, coronary atherosclerosis, 80 to 90% stenosed arteries, meaning that they were filled with plaques, and then reversing that totally on a plant-based diet 36 months later, which is pretty much unheard of. And I wish that that study was talked about a little bit more. I don't think a lot of people know about it. Not even many physicians might not know about it. So that definitely was influencing me at the time. And then also just feeling better. When I felt better during races, I was getting faster. I was like, wow, I feel really good. So why would I stop doing this? And then, environmental and ethical still also play a role for me too. Just learning a little bit more about the animal agriculture industry, how it actually takes up CO2 emissions more than even all of our cars and airplanes combined, um, as well as the animal harm and kind of the industry, getting into more of the details of that and seeing that. With all of that information, I couldn't really go back to eating how I was before.
Well said. I would like, if you could,
Mhm.
send me that study for one, please. And
Mhm.
two, why do you think, I got to be careful how I say this, but why do you think that that study is not more well known in the medical community?
I think it's multifactorial, and unfortunately, nutrition is not emphasized in medical
Yeah.
school education to begin with. If you look at it, I think on average, physicians get maybe 16 hours of nutrition training, which is hardly anything in 4 years of schooling. I think it's also hard because food is so cultural, and even physicians grow up eating a certain way, and they don't want to be told to eat differently, just like any normal person that's not a physician. So I think just that personal opinion and upbringing just influences it as well, to kind of not seek out that information. So I think, yeah, plays a lot of things play a role in that, but that's another good question.
Well said. And we'll let that one go for a while. So let's talk about more about your medical training and what you do. I mean, what you're doing, it's remarkable. And I'm like you, any natural way of taking care of this
Mhm.
awesome machine that we call the body, I'm all for. So educate us on everything you're awesomely doing.
Mhm. Yeah, so I am at Centeno Schultz Clinic right now in Broomfield, Colorado, right outside of Boulder, Colorado, where I live. And well, first, just to backtrack briefly, I went to Wake Forest for undergrad, Ohio University for medical school, and then I did my emergency medicine residency. So I'm ER trained in uh, Florida with Florida State University, and then I did a sports medicine fellowship at West Virginia University. So I've had to move a bit for my training. And I came out here because I love endurance training, and I was really tempted to just want to live out west with the access to the mountains as a snowboarder as well. And just all the pros kind of being in this area, it's very motivating, and I found that it would be a good fit for my interest. So yes, now I'm at Centeno Schultz Clinic, and we're also known as Regenex nationwide. So we actually have over 100 Regenex affiliates across the country. And there's one in Toledo, too, believe it or not, with ProMedica, um, kind of near Wildwood area,
Okay.
the Wildwood
Yeah.
Medical Center. Yes, Dr. Cruz and some other doctors are out of that clinic. So basically, my specialty is called interventional orthopedics, or regenerative orthopedics is another way to term that. And so, what it is essentially using your own body, whether that's platelet-rich plasma or your bone marrow stem cells, to kind of put those into an area with precise image guidance, whether that's with ultrasound or X-ray imaging, and then putting that into the area of pathology that's hurting, whether it's like knee arthritis, hip arthritis, Achilles tendonitis, rotator cuff issues or partial tears, all sorts of orthopedic injuries, targeting that, specifically with PRP, which is platelet-rich plasma, or the bone marrow concentrate stem cells, and concentrating those in a way that's going to fit best for each individual patient, to optimize their outcomes and then hopefully lead to healing. So we're just doing injections rather than surgery for patients.
So you're basic, and I've had two, well, I've had one knee operation, I had a torn meniscus, I've had two shoulder operations with some rotator cuff stuff. So if I'm hearing you correctly, you're using the body's own source as the fuel to heal the own body, right? Is that
Right.
accurate? Wow.
Yes. And platelet-rich plasma is pretty easy. It's just a blood draw. So you come in like you're giving blood in the morning, and then we concentrate that down in our own lab. So we actually have our own lab that does all of that. We have researchers, a clinical director with a PhD that leads the research. So it's really incredible what we have at our office in Colorado. And that's why we get people that travel all over the world, because it's, just so advanced in terms of our technology and data. And Dr. Centeno started this in 2005. He was the first U.S. physician to use stem cells for orthopedic conditions. So now we have almost 20 years of data at our clinic that we've kind of saved and researched over the years. So we use our registry with all of the patients that we've treated to kind of help keep optimizing outcomes. And that's pretty unique because not a lot of other clinics have that.
Wow. Talk about I guess what's your client type or your patient type? Is it young? Is it old? Does it run the gamut of different ages, different injuries? What are the details of that?
That's yeah. It's actually pretty much everyone. I would say that on average, it's probably more adult oriented, 18 and over, just because adolescents and teens tend to be pretty resilient and can kind of get over injuries. But as we get older, and as you know, over time, especially if you're really active, tendinopathies more easily develop, or some wear and tear. Pretty much everyone's going to develop arthritis over their lifetime. It's just that some people are more symptomatic from it than others. We treat everything. It's pretty incredible what we can treat. To give another really cool example that might interest listeners, so ACL tears. When someone gets one of those, whether it's a soccer injury or whatever sport they're playing, um, you know, people just go to surgery right away, reconstruction of that ACL ligament. However, we actually developed our own procedure to save people ACL reconstruction, where we guide a needle into the ACL under fluoroscopy, confirm that we're in the ligament with contrast, and then put the stem cells in the ligament, and then no surgery to be had. And we actually have post MRI imaging of the ACL healing, so proof that the stem cells have helped heal the ligament tear. And yeah, I mean, it's incredible. So it doesn't work for everyone. If the tear is really retracted, that's a better surgical candidate. However, if it's partially torn, or if it's still intact, looking at the MRI, and then we also measure something that's a little bit, you know, probably going to be over people's head, but it's called the tibial offset. If we measure that and it's at a good size, then they're a good bone marrow concentrate candidate.
Again, I keep using the word fascinated, but I am fascinated with talking with you. Back to the nutrition thing. Let's say you have two patients that come in. One is a plant-based individual, and the other one is not. They both have the same surgery. Do you have any data or any opinions you want to give, medically or personally, on which one would heal quicker and more effectively, and why?
So I wish that we had more data on that. We don't have great data on recovery times, or I was even wondering would stem cell counts, be different in a plant-based individual versus a carnivore. So those are some really cool future studies that I think would be great. But I do think that I would lean towards a plant-based diet in terms of optimizing your recovery after one of our procedures, just because it makes sense in terms of an inflammation standpoint.
Yep.
So PRP, or platelet-rich plasma, it's going to induce an inflammation response. That's kind of the first phase of healing. So wherever we inject actually gets worse before it gets better. So the less other inflammation that you can have in your body, I think is really helpful, just from like a pain standpoint, but also kind of so your body knows the area where to heal, and there's not so much other inflammation going on elsewhere in the body. Hmm.
I think it's interesting, and we can transfer into your Ironman stuff in a second. But it blows my mind where you'll people that'll do an Ironman. Obviously, your muscles are inflamed, and they think it's a good decision to go out and have a cheeseburger or a pizza afterwards, which just totally enhances that inflammation. I'm like, what?
Right.
What are you doing?
It's tough because I mean, I understand like wanting to reward yourself after you had
Yeah.
a super hard workout or a super long race, and you worked out hard. I mean, we have to replenish, we have to refuel. But I think having balance in that, and if you're going to eat fries, putting a black bean burger with it's at least a little bit better in terms of that post race inflammation. Um, so yeah, it's tough. I understand. I definitely still think that people should treat themselves after an event like that. But I do think that I agree. It kind of defeats the purpose of going to do that exercise if you're constantly just refueling with those inflammatory foods.
I agree. So talk about Ironman. When did you get into it? I know we've done Ironman North Carolina separate
Mhm.
years or whatever, but why Ironman and what have you done in it?
Yeah, so I was just like, a marathon's not hard enough. Let me try something else. So I was living in Florida, and I thought that, since it was so hot, oh, let me start swimming again. Let me cross train a little bit more. And COVID had also hit when I was down there, and there wasn't as much to do. So I was like, maybe I should start biking again. So I started just kind of getting back into swimming. Biking, and then I jumped into some local triathlons down there while I was in residency. I ended up winning like three different local races, and I was like, wow, maybe I'm pretty good at this. So and then I had signed up for my first half iron and kind of set that as a goal. And most people would think I'm crazy for doing that during residency, which I probably was. But I actually felt like it was really nice to have some kind of regimen to follow, to keep me on track and kind of distract me kind of from the stresses that I was going through in residency. So and then I did my first half iron and qualified for the world championship, was pretty high in my age group. So that was pretty fun. I ended up doing around 5 hours flat for my first one, without a coach or anything. And, I didn't think I overtrained for it. I think I trained around 8 hours a week, which is on the lighter side
Yeah, it is. Yeah.
compared to some. So I was pretty happy with that. And then I did the St. George, Utah 2022 World Championship for the half distance. Did okay there, but I was in fellowship just working too much. So my training kind of wasn't where I think it needed to be. And then after that, unfortunately, started dealing with some injury again. With that's when my Achilles started a couple months after that. So took a break for a little while, but then more recently did the June Boulder half Ironman. So I've done three half Ironmans.
Awesome. I give you a lot of credit for doing the worlds in St. George because I was there.
Hmm.
But that race, remember how cold that was out there then?
Yeah, it was hard. Yeah, it was 30 some degrees, and the water temperature was around 55. And just, yeah, I've never been so cold after getting out of the water on the bike. I was thankful that I prepared in terms of having a long sleeve jacket and the shoe covers and gloves that saved me. I know there was a couple pros, I think, who underdressed and regretted it and felt like they were hyperthermic for half the ride.
Yeah,
Mhm.
I'm not embarrassed to say this. I didn't even start. I was like too cold. I do not do well in the cold. I've done quite a few of these things, and I woke up that morning and I was like, not today. So I give you a lot of respect for even starting, let alone doing so well that you did at it. That's awesome.
Thank
Yeah.
you.
Do you have any plans in the future to do more or even tackle the full Ironman distance?
I would like to. It's just about kind of getting healthy and getting that base
Yeah.
back. So I recently had several PRP injections about 5 weeks ago into a few areas. So I'm hoping to heal up, be able to get back stronger. So yeah, ideally I would love to get to Kona. That's always sort of been in the back of my mind as another goal.
Yeah.
So,
You'll
but
be there.
to
Yeah.
be determined when. But I think if I can get to the half in Boulder again, that'd be nice. Just since it's convenient and
Yeah.
I can just sleep in my own bed before the race, which is always nice. That would sort of be on my radar for this summer again to do, or at least some of our local triathlons here, and then build from there.
Awesome.
Mhm.
I know we've covered a lot. Is there anything else that you want to talk about today?
Hmm. You've asked a lot of good questions. I feel like we got a lot of info in a short amount of time.
Or do you have a question for me at all? I always ask anybody if they want to ask me anything.
Well, yeah, I mean, I'd love to hear kind of your thoughts with just having a family member with addiction and not really being able to help them as much as we want to, because it never really seems like they're kind of ready to make that step in terms of getting sober. Do you have any advice regarding that and how families can navigate that process?
I'll try and relate this to your profession as a doctor. You know how you may have a patient that knows they have a problem, they need surgery, let's say, or they need your services. They know it, they've been trying whatever to get around it, it's not working, things are getting worse, all that, right?
Hmm.
You can only do so much for that patient until they decide they're going to do something for themselves. So, having said that, relating to addiction, I believe family members should constantly put information, give examples. Hey, did you see so and so that has overcome their addiction? Here's how they did it. Does that have an interest to you? Give them examples of, look, I know you were awesome at playing the guitar, or you were highly academic and wanted to be a physician when you were younger, but the drug addiction took over. Have you ever thought what it would be like to pick those things back up again? I believe in being supportive, at the same time being firm and not enabling that loved one in any capacity. For example, if they call and say, hey, can you give me some money? The answer to that is always no. If they call and say, hey, I need a ride to a support group meeting, or I don't have any money, could you buy me that book on rehab or somebody that overcame their addiction?
Hmm.
Sure, I'll do that for you. So it's a very fine line between supporting and enabling, but it's a big difference in what kind of care is going to be utilized the proper way. It's
Right.
kind of, when I was giving you that analogy with that patient, that it's kind of that same mentality. You constantly put things in front of them and hope that they make that right decision for themselves.
Exactly. Yeah. Yeah. Our job is to educate, and then the patient's job is to make that decision. And it's sort of in a similar fashion, the same way with anyone kind of wanting to make that next step to get sober.
Absolutely. And one of the things that I'm very proud of with Racing for Recovery, we're the first program that developed a live stream support group meeting. So every Thursday night, people, can chime in all over the world and either watch the live stream. There's a chat on there. We're looking at integrating some Zoom calls to take some questions or concerns from loved ones out of the Toledo area. So that's another way that people can stay at home. They can be involved, because a lot of times people have anxiety about coming into a meeting. And this way it kind of takes that anxiety off the table. And it also gives a great way for family members to get around other family members to see what worked for their family as well.
Hmm. Yeah, I should refer my family member to the That what day is that?
It's
That you guys do?
Thursday nights at 6:30 on our YouTube and Facebook pages.
Okay, great.
Are they local? Are they in Toledo?
Not Toledo, but in Ohio.
Okay.
Hmm.
Well, and off the record, but on the record, they can always reach out to me personally. I mean, you know my Instagram, and I'll answer any questions they have as well.
Sure, yeah, that'd be great.
Yeah.
Hmm.
Well, I really appreciate talking to you. We got everything covered that I wanted to ask you about. Any final words you want to say to anybody?
Uh, if anyone has any questions about, regenerative orthopedics, or if they're thinking about getting a PRP injection, or even going the bone marrow stem cell route, or even just to talk about plant-based diets, how to make that switch, or any advice on that, I'd be happy to answer any of those questions. So, in my social media page is at Boulder Sports Doc for Instagram.
Awesome. Thank you so much for coming on today. I appreciate it.
Yeah, thanks, Todd. It's been great talking with you and good to see you again.
Likewise. Take care.